Good afternoon, Dr. Giridhar Rao. You are an anesthesiologist from Kuwait.
Yeah.
Now you have retired.
Yes.
And I would like you to share your experience. Doctor, why did you want to become a doctor?
It so happened that my father was also a doctor in the railways. And at that time, when I finished my schooling and came, medicine was the most sought after career. And the best students used to go for medicine. So I went for competitive entrance exams and passed the exam and got selected in Jipmer Pondicherry. That's where I studied.
Wow. Then how did you get interest to become an anesthesiologist?
That is during the course of my studies. After finishing my MBBS, we have internship, compulsory rotating internship. Out of 12 months in a year, 1 month we can choose for any medicine or surgical subjects. So happened, I chose anesthesiology. And I liked that training and the education there. So I thought this is a nice calling which I can take up for future.
That's really
so
good.
that's why I became an anesthesiologist.
That's
No
really
regrets.
great. That's really great. Doctor, you have been working in India and you worked in Kuwait for almost 27 years. Can you share your experience?
Yeah, it's been more than 40 years I've been in the profession. It has been very rewarding and very exciting to be in that profession because I got to handle very many sick patients and very critically ill patients. And so both in India as well as in the overseas. So I had many patients. Even though you have the academic skill and the knowledge, though you need a superpower to guide you and bless you at critical times. So that's why you will find people who are very, very experienced and highly educated in the profession, the more you study and more you experience, more you become humble and pious. You believe that something, a supernatural power is there to take care of you. There will be times when you will pray for the hand of God to be on your head to take you through critical times.
That's really great, doctor. That's very true. Can you please share a patient experience where you felt this?
Many, I cannot tell you only one particular incident.
Because as anesthesiologist, every time you put the patient to sleep and wake them up, every time it's a great challenge.
Yeah, every time it's a great challenge because our job involves the airway and breathing, which is a fundamental requirement for any human being. Just few months before I retired, I came across a young lady who was coughing sputum with blood. And she was a young school teacher, primary school teacher. She was otherwise well. So I was called one evening and to see one patient who was coughing up some stuff which is not, which looks like blood, but is sticky like a small pebbles. You know, pomegranate. It was like that. So people were wondering what it was. So I went and introduced myself to the lady because I had to give anesthesia for that lady for endoscopy. Endoscopy means they have to do direct laryngoscopy, bronchoscopy to see what it is. So I went to see her. She said, I believe you are having some cough with bleeding. Even now I have, she said. Then what comes up in your sputum? See, she was playing with some pebbles like thing, like pomegranate pebbles. She coughed and brought it out and she was playing with it. So it is something from the airway From where is it coming? It must be coming from the lungs. But otherwise the lady is very well. She was an intelligent lady, educated lady, Kuwaiti. Then I told her, see, your X-ray, everything seems okay. You are bringing up sputum with this material which is coming from your lungs. There is some abnormal communication between your lung and the breathing passage. For that we have to do a test. What is the test, doctor? She asked. I said, we are going to do endoscopy to see whether we can repair it or you have to do something else. But I cannot give anesthesia for her to get into the airway without putting her to sleep. It may be very dangerous. So I have to do all these things when she is fully awake. Because for that I need her cooperation. So I told her, we are going to give you some local anesthesia. We are going to make you sit. We are going to collect all the machines, the monitors, and we are going to see how you are behaving. At any point of time, you feel uncomfortable, you put your finger up like this. If you are feeling okay, show me like this. If you are not feeling okay, show me like this. Then I will stop the procedure and ask you what is bothering you and try to correct it. Because she was an intelligent girl, I would say girl because she was a young lady, she understood. But don't be afraid, I told her. If there is anything dangerous, we are not going to harm you. No, I am a bold person. I am not afraid, she said. Then I took her to the theatre, and we found there was a small rent in the breathing tube. We call it trachea. So after that, because we were given good anesthesia for her, she cooperated with the introduction of the tube for giving anesthesia. Once we gave the anesthesia, then the rest of the operation went through very well. Then we got the ENT surgeon to sew that rent in the trachea.
Oh,
Next day morning, I went and saw her in the ICU. She was saying like this.
That's so sweet.
Doctor, good morning. I'm fine, she said.
That's so sweet. Thank you.
This is
doctor.
unforgettable, though rare.
Yeah, really, doctor. Like that, every case you will be saving a patient in different manners. That's really great.
Yes.
Doctor, would you like to give some steps for the young doctors who are just coming up now?
What I want to tell young doctors is, every branch of medicine is very important. As a doctor, you are given a unique privilege to serve humanity. It can be it can be neurosurgery, it can be obstetrics gynecology, it can be family practice. You are treating fellow citizens in the world. That's a very unique privilege. So if you study well, if you train yourself well, you practice medicine in the right way, then God will be with you.
Thank you, doctor. Thank you very much.
Thank you very much.